Dr. Christine. It's exciting to have you today. I came across you by interacting with you on LinkedIn because you provide fantastic advice for medical professionals who are trying to get into the biotech and pharma space. But I want to start the conversation with your story, right? Like you're a pharmacist, you have a pharmacy degree. What made you want to start something like this?
Uh, I do have an interesting story because it was quote unquote out of desperation. All right. So,
Mm,
when I graduate pharmacy school, everybody is pushed into the clinical setting, the traditional setting. So, for the most part, it's about either you go to the hospital, work in a clinical setting, or go into retail and maybe do the academics. When I graduated, I was like, okay, I'll do a residency. I'll see what that is because I've had a few rotations already. It's like,
mm,
okay, it's doable. That full year of residency made me realize, and I did my residency at Johns Hopkins. So it's one of the top residencies you can possibly get within pharmacy. And I knew for sure it just wasn't for me. Like I just had this epiphany of, I don't know if I can do this like day in, day out as a career. And so, it was a process by elimination. Retail, for sure, no. Clinical, I already knew I didn't really want that. Going back as a professor in an academic setting with students, I'm thinking, I don't know what kind of social life that would look like. It's not very promising. I don't want to be around students, at least at that, point in my career. And I said,
mm,
what to do, what to do. So I ended up, in my head, I had a lot of pressure. I had student loans. I went to a private university to get my graduate degree. So I have a lot of money to pay back.
yeah.
And then and I have a lot of friends who graduated and now suddenly they're making an enormous amount of money working even just at retail pharmacy because during that time it was the golden age of pharmacy where you get out graduation and you make $120,000. Sometimes they might even throw in a bonus for you, which is like a car or some crazy sign-on bonus. So it's like, wow, like at that time, everybody wanted to be a pharmacist.
Mm.
I was probably the lone wolf in this where I'm like, I'm so miserable. I can't muster, even if it's gonna probably make me financially more stable, at least at that time.
Yeah.
I was like, there has to be another way. And so entering the fellowship, which at that time, this was over 20 years ago, right? I know I still kind of look young, but um,
We look young. We look young.
yeah, during that time, it was, I think, five fellowships, right? And I was still looking very specifically within pharmacy, and I just didn't know anything else. I've heard about pharma, med info, but at that time, I really didn't know too much about it. All I knew was you're going to be part of a call center, you're going to pick up calls, and I'm thinking that
I
does
didn't go
not.
to pharmacy school for this.
I don't know if I want that, right? And
Right.
so I ended up doing a fellowship, just almost a transition, kind of like a landing, like a temporary landing until I figured something out. I figured it was different. I've always done research, even during my undergrad years. So I was like,
Yeah.
at least I kind of like that. Let me just step into that and just buy myself some time. And
Yeah.
so that is what triggered my career in biotechnology and later into pharma, where I discovered it's like a whole new world. I mean, it was crazy, and I was thinking nobody talked about this when I was at school.
Yeah.
All I heard was the hospitals, the clinics, all these different retail pharmacies, and that's where I started. 20 years later, I mean, that's, I can't, there's no regrets on my end. I spent 50% of my career in R&D, and that includes preclinical, and then I got into global clinical R&D, launching clinical trials. And then later on, I pivoted into medical affairs where I started as an MSL and then evolved myself to later on head of, field medical and executive leadership positions.
That's a really exciting journey. I have so many questions. I have so many questions about that actually. But before we get into we delve into, maybe we should do that. Maybe we should just delve into your career a little bit before we start talking about the coaching business you have and also how people can practically set themselves up for success who want to enter into biotech and pharma, right? And so what was your first role in once how did you find out about that role and what was your first role?
So my first role, I was a scientist.
Okay.
It wasn't very glamorous. I called it washing dishes, right? So I was doing a lot of in vitro, in vivo modeling.
Okay.
So for products that we need to identify how to move them from just chemical entities into identify them as clinical candidates. So I started out as a scientist, and I was the only pharmacist in the entire biotech company. And it was a small company, and they're still around. It's in pharmaceuticals.
Yeah.
And I always get these looks, you're a pharmacist? How did you get there? But the way I got there was while I was doing research during my fellowship, I got connected. I got connected with, some of these network, right? People hiring managers, and I got to know them, and that's really how the opportunity opened up. I didn't really apply per se. It was more of, hey, we have an open position. You should consider it. We'd love to have you over, and that's how it started.
And that was through your network, right?
Yes, yes. And it's, I always tell, even till now, right? I always get asked, how do you get into pharma? How do you get into biotech? I mean, it's really a multi-pronged approach, right? Certainly there's the job applications you find on LinkedIn, Indeed, etc. You apply directly, but that is probably where 99% of the people they do, right? It's like click, click, click. But it really is a multi-pronged approach. So beyond just applying and fixing your CV, you need to be able to network strategically and really be targeted on what it is that you want. So you need to almost ground yourself. Very similar to what I did. It's like, okay, it was almost process of elimination. I don't want this. I don't want that. I think I can do this. So I think everybody, for anyone who is, I think we're all in career transitions, but for those who are thinking, I need to pivot on my job or pivot into the industry, find your core, anchor yourself, what it is that you're very good at, right? And the reason for that, or one of the reasons for that, is we're all qualified. We have PhDs, we have scientific degrees, right? So automatically we qualify for a lot of things.
Yes.
Right? We are, there's a lot of skill sets that we can transition over. But the
Yeah.
question is, how do you position yourself? Number one. Number two, what kinds of roles do you gravitate to? And
Yeah.
number three, how can you help? Based on what you have, what are some of the things that you can help with, right?
Mhm.
On those companies or specific roles.
Yeah. Christine, if somebody hasn't done something before, how do they know to eliminate that? So let's say you don't know that you're going to like an MSL role, or you don't know you're going to like a medical writer role, or you don't know you're going to like an R&D scientist role. Maybe R&D scientist is different because a lot of us end up working in the lab if you have a science degree, but and so maybe you kind of determine that you don't like working in the lab or you like working in the lab. But if you haven't had that experience, how do you eliminate something or settle on something?
Yeah, so it starts with preparation. Okay. I
Mm-hmm.
mean, it's so easy now to do a little bit of research, right? We have
Mm-hmm.
LinkedIn. You can just reach out to somebody, or now, I mean, we have a lot of information online as well. A
Yeah.
lot of free information about specific careers, trainings, certainly a huge network that, it's easy to reach out to.
Yeah.
I think just having that mindset of let me check various career paths and talk to people, because
Right.
you have to talk to several people too, because
Yeah.
everybody they'll give you advice, right? varying advice, but
Mm.
you'll find the core of what it takes to the pros and cons with a specific career. And
Yeah.
the question is, does that jive with you? Is that something you can really, crystal clear and enjoy? Right?
Yeah.
Or with preparation. I think the one thing that most people do is, well, I need a job in 6 months, right? And what ends up happening is, well, now you've just narrowed down significantly the time to explore. I mean, you need to do this way in advance. I mean, that's one of the things I wanted to impart on the newsletter that I just released this past weekend is, understanding how the market flows and the different products that are out there can really, help you develop a strategy, right?
Yeah.
It's like, okay, and it will dictate the types of career you're going to have as well. So, if you're into, like, say, medical writing, find out what type of medical writing do you enjoy? Do you like short pieces? Do you like long pieces? Because these are very different. Like, your work life and the way you interact with your team is very, very different. I've done a little bit of both. I used to do regulatory submissions. So, some of these packages that I had to work with and write. I mean, I used to do phase two CSRs, right? Phase one, phase two CSRs, IBs, IND packages. I mean, they're in the hundreds. And sometimes once the packages are complete and we have to QC and audit them, they're in the thousands, right? But that is part of, the medical writing team's job, right? So everybody has different roles. So versus, like, say, in a pub, like a pub meds role, or, like a CME role, the pieces are much shorter, right? 8 pages for a publication, etc. So there are so many nuances with each job, and it's really up to the individual to really find out, number one, what do they not want, right? You don't want to go from one frying pan into another frying pan. You want to be sure on what you don't like. Okay, I always start with that. What are your non-negotiables, right? And then kind of move forward that way.
Yeah. And so you get there by chatting with people, right? You get there by doing informational interviews and really learning what is it that people do. And I love the fact that you used medical writing as an example, because that's a perfect example of a profession that has one name, and yet you can do 20 different things in that same profession, and everybody's role is different. And I had to explain this to a few aspiring medical writers myself, like, what kind of medical writing do you want to do? Because if you tell me you want to be a medical writer, that is not any information, right? I can tell you what I do, but that's not going to be representative of what my other colleague, who is also a medical writer, does, right? So that's really, really helpful. And then you moved on from there into various other roles. Now, this is a place where I am currently, right? And I'm probably going to ask a selfish question here. So I've been an individual contributor for going on 5 years now. And that just means, for those listening and new to that term, that just means you are the only person in your role. You're not necessarily managing people, right? And some people love this type of role, individual contributor roles, and are in it for decades. But sometimes there's also opportunity for you to advance and become a people manager. And that's a goal I have this year. So based on your experience, right, what advice would you give to somebody like me who, let's say, they've broken in? We're going to talk a little bit more about breaking in and getting in, but they already have done that. They've been in an individual contributor role for a few years, and now they feel like they have, or they feel like they've plateaued. It's the same thing they're doing day in,
Yeah.
day out. For some people, that's fine. For some of us, we like variety and we like excitement. So, what advice would you give to somebody like me?
Okay, that's a great question, actually. So I completely relate to that, right? I actually have quite a few people who are in this exact space where they have numerous years of medical writing experience, but now it's like, well, what's next? Because I've outgrown my current circumstance, and I'm not even sure if I want to be a manager, right? Transition into, I mean, okay, so let me just kind of step back. There are different paths, right? So you can either become a manager, or you can transition into a different specialty, or you can transition into a completely different role, but maybe still overlaps with medical writing, right?
Yeah.
And so I think for a generalized advice, right, for people is it really comes down to how you position yourself, right? And what I see most people do is, especially when I first speak with them, it's like, oh, what do you currently do? What are your, what are your, how do you move forward? What are your dreams, if you will? So when they tell their narrative, it's so very narrow. I developed X, Y, and Z. I did X, Y, and Z. It's very task oriented, right? So it starts again with how you tell the narrative from a mindset perspective in terms of the impact that you had on the projects or the clients or your company. So always kind of move forward. I call it the ripple effect. So you have the first layer, which is here's what I'm doing. I'm writing, I'm, doing X, Y, and Z, right?
Yeah.
Or you can be like a team lead,
Mhm.
right? You're already leading people. But at the end of the day, what is the impact? What is the outcome? Now, if you think of it that way, right, like several layers up and tying what you're doing to outcomes and impact, it opens up your mindset to,
Yeah.
I mean, because the way I see it, for example, in management, right? I think management is, again, is such a very vague word, or even leadership. It's so vague because I think that, we all exemplify certain levels of leadership, right?
Yeah.
Particularly self leadership. We are all part of a system. Nobody, at least in pharma and biotech, nobody works alone. And as you know, within a medical writing department, medical writing team, there's always, someone who QCs the references, make sure that it's the right contacts. There's the actual medical writer who does the first draft. There's an auditor at the end who does this, and then maybe somebody who submits this for a regulatory legal review, right? Whether it's through like PRC or MRC. And so there are many levels within that. And so as we look into our career and thinking about transitioning into a different role, like say management, it's really important to first understand our impact, because it shows when you communicate to other people. Like when you engage, when you network with other people, it has a much different ringtone. And when you're crafting your CV, obviously, right? It's like all the bullet points. It's a very different perspective, and most people are, I call these blind spots, right? It's hard to think beyond what you're doing if you've been doing it for so long.
Yeah.
And and I see that with a lot of my clients, and that's what I help with, right? It's
Right.
covering those blind spots and really creating more of an open mindset, if you will.
Every other Friday, I send out an email newsletter to about 3,000 PhDs and academics on tips, tools, and resources that you can use to build a career you love. And I'm inviting you to join us. You can go to theboldphd.com/careers list. Again, that's theboldphd.com/careers list. Let's get back into the episode. Yeah. So what would an example of communicating your impact be? So let me give you my scenario, right? So over the last 5 years, I have written ebooks. I have written ebooks and white papers and application notes for Fortune 500 companies. And these Fortune 500 companies use these assets to educate their audiences to purchase products. A lot of these products are in the six-figure range and above, the six-figure and above range that they sell. And so my role assists, right, helps with educating and marketing and sales. Now that you've heard what I just said, how would you coach me on communicating my impact?
I think you did a very good job right now of your impact, because you added some numbers, right? There's quantity involved, and then you talked about who you helped, right? So there's the quantitative piece, there's the specific audience, okay? And then what the outcome is in terms of increasing sales or education, et cetera, et cetera.
Mhm.
Now, the next level, right? The next level would be, giving specific examples of what that looks like. So if you
Mhm.
kind of think of your CV or your narrative, that would be your opening line, right? This is what, when you're introducing yourself during a networking session or maybe on your LinkedIn, on your profile, that stands out. Okay. Then the next thing would be, what are some of the specific examples? Like anchor yourself on specific examples, right? And that's what you would create like bullet points, a very similar format. Give some sense of what the scope looks like, who the audience is, and what is eventually the impact,
Yeah.
right?
Yeah.
Whether you created awareness, helped educate clinicians, etc., etc.
Yeah.
Now, the way you tell these stories, I will say, depends on what you're applying for or to, if you will, right?
Right.
So,
Well, of
if
course.
it's a
Yeah.
management, so you have to kind of finesse it a little bit. So, if it's like a management position, for example, right, where, okay, you're going from an individual contributor to a leadership position, I mean, you can say that you worked, right, effectively with other people to achieve a specific goal and outcome because a manager's that's what they are essentially. It's
Working
making
with
sure
people.
that all the pieces, yeah, fall into place. You have the resources, etc., and to move things forward. So you're essentially projecting not only your competency in self leadership and leadership within a given context, but also showing them your potential and what
Yeah.
you've achieved.
Thank you. That was very, very helpful. And I hope it helped, for the people listening and watching. I hope that helped you too think about that. So now we're going to take a step back for the folks that are like, okay, I've been trying to get into biotech. I've been trying to get into pharma. I'll give you a scenario for this as well. This is somebody that just finished their PhD. They don't necessarily want to go into a postdoc. They just want to go straight into industry. Where should they start?
They should start with research, right? I mean, like going into target one company, say,
Mhm.
right? Well, let me step back. First, understand what are your non-negotiables. What do you not like, right?
Right. Like you said.
And
Yeah.
yeah, and I think that is by far the most challenging and hardest thing to do because you're graduating, you don't know, right? But I think you can pretty much, if you look back into your rotations or the type of projects that you've done,
Yeah.
you can pretty much tell, like, all right, did I like working with other people and just dealing with their problems? Because that's what if that's, for example, an MSL role
Yeah.
would have to handle, right?
Yeah.
You're not
Yeah.
dealing research animals writing. You're working with emotions, with egos, with a lot of different things, right?
Yeah.
Because you're engaging with people. So just understand yourself first and then do your research.
Mhm.
What I teach people to do is, or what I tell people to do is focus on maybe three companies, right? Your three North Star companies, and then go deep, right? See how these companies, what types of roles, right? Understand where they are in, the product process, right? Are they a small biotech company? Are they a large company? I mean, have like a medley of, maybe small, mid-size, and large, and then go deep, right? And ask yourselves, like, okay, what are some of the roles that's, that they're hiring PhDs for? Okay, that narrows it down significantly. And then that would give you some ideas on, where, from that perspective of a background, where do people end up going into? And you'll be surprised because there are so many roles, and unfortunately, in pharma or biotech, the titles are all over the place. I mean, sometimes it's just like people just make
Yeah.
up titles. It's like, okay, this sounds good,
They
right? And
just
that's
make
what
up,
it,
they just make the words up. Yeah.
yeah, yeah. And so, but you get a sense of, what from a functional perspective, what does that function look like, right? What specific therapeutic areas, if you have one, right? Like, okay, you look back on what you've done in terms of research, what you gravitate to, what some of those therapeutic areas are, because as we know, pharmaceutical companies, they have a portfolio, right?
Yeah.
So
Hmm.
if your strength is in cardiovascular disease, I would target companies that have cardiovascular disease pipelines and products, right? If they don't,
Right.
then don't even look at them. There's just hundreds and hundreds of companies. You don't want to burn
Mhm.
time looking at other companies that don't even have your specific specialty or specific competency, if you will. So yeah, I would go down, and see, if you can map out like what are some of the roles that are out there, right?
Yeah.
Print out some of those job descriptions and start connecting with people. And that's how I would start for
Yeah.
for those entry level roles. And again, a lot of these entry level roles, they're not really entry level, as we know, because there is a certain level of competency that is
Hmm.
required, right?
Yeah.
And
Yeah.
depending on the candidate pool, you're competing with that pool, right?
Yeah.
So, and right now, as we know, it's a very competitive market, right? Being
Yeah.
qualified is not enough anymore. You have
Yeah.
to be extremely strategic.
Strategic, yeah. I enjoy what you said about if you have, let's say, if you did research on a specific topic, then and there's a company that is works on that topic, then or works on drugs or products that serve that patient population, then that's a really good place for you to pivot. But also, one other piece of advice I actually gave somebody this week was she was very, very focused on the disease area she was working on, like the disease area she had worked on in academia, in research. And one of the things I told her was, I think you're focusing too much on the disease and forgetting that you have all these varied skills that could also fit into, well, it also depends on the type of role. If you're going into an R&D role, then it makes sense that you have a specific set of skills, because usually they are. But for instance, if you're going to a data analyst role, right? If you're going to a medical writer role, your specific therapeutic area may not matter as much. What do you think?
Um, yes and no.
Okay.
I think it depends on the career level. Okay.
Right.
Someone who's starting out, say outside of the industry, right? They're
Mm-hmm.
starting out. We have to identify two things: functional skill sets, right? And therapeutic expertise. Because we look at every pharma company out there, they are driven by portfolios, right? They
Yeah.
might have a neurology portfolio, cardiovascular portfolio, et cetera, aspect. And the functional aspect is, from a, what is it that you do very well? Have you done medical writing, right? So if you've published, of course you've done it. If you've done research, okay, what types of research? Because there are nuances with research too, right? It's like phase one, phase
Mm-hmm.
two, observational, preclinical, and then getting a very clear picture on what that is. And so I would lead with, positioning your, I call it skill stacking, right? And this is how you essentially brand yourself, or at least, in a most basic sense. But basically, you say, I have experience in functional area, specializing in therapeutic area, right? In a more basic sense, if you will, because
Mm-hmm.
that it sounds very narrow, but at the same time it makes you memorable, because not everyone is going to have the same skill set, background as you would. I think one of the biggest challenges, and I think mistakes that I see with people is, especially when they come, there's like, oh, I can work in, I can learn anything. I've
Right.
done all the, therapeutic areas. I can plug myself. I've done medical. I've done all of these things. But
Mm-hmm.
I mean, it's great, right? I think the underlying truth is, as D degrees, yes, we can learn anything. But
Yeah.
from a marketing perspective and a brand perspective, you have to really position yourself to be memorable. Okay.
Mm-hmm.
The only people I remember are the ones who tell me, I want to be a medical writer, specific, and I'm a specialist in cardiovascular disease. Got it. I got it, right? It's but then if people start, it's like, yeah, medical affairs, maybe medical writing, all these things, it's almost like a cognitive overload, right?
Mm-hmm.
Especially for, you and I, we talk and engage with hundreds of people. And just imagine these hiring managers are in the same position. They're probably getting bombarded with, hey,
Yeah.
just wanting to reach out on your post, et cetera, et cetera. It's very, very hard, right? So, one way to really brand and position yourself is be laser focused on, these key areas that you have, and really focus on them because, like I said, it's a very competitive market, right?
Right.
If you have an experience in, say, cardiovascular disease, I bet you some other candidates will up you on that. Say, well, I have publications, I have research, I've given Congress presentations on cardiovascular disease. I mean, that is the level of competition that we have right now. But, that shouldn't really, discourage anyone because, again, it depends on being crystal clear on your value proposition. And that is where 99% of the people miss out on. I have a lot of experience, but they're not really telling the hiring manager, so what, like, so
Right.
what are you going to do for us, right? And so that is the biggest miss.
Hey, did you know that I speak to and train groups at universities, colleges, and professional organizations on the topics I cover on this channel? I do. So if your group would like to bring me in virtually or in person to cover intentional career design, personal branding that builds your career, careers within scientific communications or biotech, go to theboldphd.com/speaking.
That I see.
Yeah. Yeah, that you see. That's really good, especially with the market we have now. I love that you say, so basically what you're saying is like make yourself memorable. And the way you make yourself memorable is by being very specific about who you are and what you offer, right? Because and this aligns with something I was reading yesterday, which I was from. It's a book called Strategize to Win, and the person was saying, and I've also thought about this, right? We don't realize that whenever we are going for a job interview, it's essentially a sales pitch. It's
Oh, yes.
the other person, the interviewer is your buyer and you are the seller, right? And you're trying to find out from each other. And this is where I think sometimes interviewers feel like we're powerless. You're not powerless, right? It's like, I know that, being unemployed is no fun. I have definitely been there, but you're also finding out if it's a good fit and if
Yes.
your services will match whatever it is that they're buying, right? And so being able to say, yes, I'm the person that you need for this particular need is going to be really important. And that's how I've always seen it. So every time I write a resume, I want to write a resume that when people pick up, they're like, oh, this role was tailor made for this person.
Yes, yes. If we take that another level forward, right? When we're interviewing or engaging with people, it becomes more natural, right? Have something in common that you can talk about, right?
Yeah.
Versus
Yeah.
is like, oh, you're in infectious disease. I'm, my specialty in diabetes, and so I'm just looking for a job. Anything, it becomes
Yeah.
so uncomfortable for both sides.
Both
And when
sides.
you're interviewing, right, the idea is you are the person for the job because you understand the market. You've done X, Y, and Z, or whatever.
Yeah.
If you have specific products that you've worked in that specific space, then awesome. You can talk about it, right?
Yeah.
You can talk
Yeah.
about those in the interview. It makes it a much more compelling narrative than I don't have specific experience on that, but I can learn, right? It's not as compelling.
It's not as compelling when we say we
Yes.
can learn. Yeah.
Yeah.
So
Now
what if,
I do,
yeah, go
sorry,
ahead.
I
You're going
just
to say
wanted to
something.
finish. So, I mentioned earlier that, it depends on your career level, right? So, what I mentioned earlier was when you're entry level, right? When you're trying to get into the industry, focus on your, I guess it's the same concept, focus on from a functional and therapeutic expertise. Now, if you are further along in your career, right? You're, 20, 30 years out. The same rules apply or concept applies, but it depends on what you've done and where you're at. So if you are an executive, you've done that leadership, you've done a lot of things. So, naturally you have, probably by then different therapeutic areas that you've focused on. Then you can lean in more from a functional perspective, right? You can say, I've led teams. I've, and give us more of a scope, global teams at a national level. So now you position yourself more as a leader where the therapeutics, it doesn't really matter as much, right? Because you've done a lot, you've already shown competency. So I think it just depends on where you are, but at a basic level, I would say, for at least I think a lot of the people in this audience, yeah, I would focus on functional therapeutics, and just really know what you want to focus on.
So good. That was so helpful. And thank you so much, because I'm now, there's so many ideas buzzing in my head. Functional, therapeutic area, branding yourself. It's all really good. I think the frustration people have right now is, I'm doing a lot of these things and it feels like it's a never ending battle. It's an uphill battle. What kind of encouragement would you give to these people? Because it is a challenging market, and you hear of layoffs and it's scary. So what would you say to encourage somebody in this environment?
Yeah, I'll say your time will come. Consistency and persistence wins every single time. So stay the course, be very focused on your goal. It will come, right?
Yeah.
And that's what happened to me. I mean, I was very discouraged, when I graduated pharmacy school and then
Yeah.
did my residency. And I'm thinking, oh my gosh, I spent all these years. 90% of the jobs out there are not for me. What the
Right.
heck do I do? Right. And
Yeah.
I didn't
Yeah.
really have mentors then. Right. I was like, well, all the quote unquote mentors are all pharmacists who are working traditional roles. They're not going to be
Mhm.
able to guide me. And so I think stay true to yourself, never waver. And, be courageous, I think, right?
Yeah.
But what do they say? It's no risk, no reward, or something like that.
Yeah. No risk,
And
no reward. Yeah.
it's so true.
Yeah.
If I decided, and it was so easy, it would have been so easy for me to just say, hey, you know what? I'm going to take this pharmacist job just so I can, pay the bills. Even if I hate it with a passion, I'm just going to do it. I didn't do that, right? I was
Mhm.
like, nope, I already know I do not want that, right? And my parents were like, when are you going to pay your loans? Is this a real job now?
So I think no, it's so good. One of the things I want to say, I want to interject here, maybe you and I can discuss this, is what if somebody really needs to pay their bills though, and they don't have anything just yet?
Yeah, that's a good question, right? I mean, take on a transition job, right? But I wouldn't do something that you already know you hate, right?
Hates,
So
right?
say for example, your PhD, and I don't know, to do research, right? Do transition job, do marketing, do copywriting, like something outside of that non-traditional path, if you will, right?
Yeah,
Because those are still very valuable skill sets,
skill sets. Yeah,
right?
yeah, I agree with you.
And I think when it comes to career, it's so important to be happy, or at least feel fulfilled, right? I mean, you're not
Mhm.
going anywhere if you just hate every single minute that you're what I mean, then you will get even more pressure and burned out, honestly, right? Because you're constantly thinking, oh my gosh, it's like, how do I pull myself out of this, et cetera, et cetera. I think we need to think of, I call it the abundance mindset, right? It's thinking of, you're gonna get there, you have a lot of opportunities, and it's just the challenges that you have to figure out how to overcome. Okay. Of course, if you're struggling to find food on the table, I mean, or pay rent, and that's a different story. But I
Yeah.
think for most of us, I think we can probably sustain, a year maybe, and do maybe on a side job to kind of continue on with that process.
Yeah, and I went through something like that, and that's how I ended up in medical communications. Because whilst I was like, I don't think I want to go back to academia. I started a freelance writing business, and so that's what we're not saying like completely stay out of the workforce. Like especially when your bills need to be paid, find something to do, but never give up on your dream. That was this was a really great conversation, Doctor. On thank you. Where can people find you if they want to work with you?
Yeah, so my coaching practice, it's called Telmedica. So I do have a website, right? It's www.telmedica.com, but I'm also on LinkedIn. I actually recently started in my Instagram and my Facebook. So you can reach out to me. I would say LinkedIn would be the best place because I'm always in there, and I'm always offering free Q&A sessions, classes, and if I may, right, I just kind of want to do a quick plug in if that's okay.
Yeah, that's
Um,
fine.
One of the things that when I started my coaching practice 2 years ago, my goal is to really help people create new career paths. I think we are so brainwashed coming out of school and even in the environment that majority of us are in. We don't know any better, right? So if you ask your friend, talk to your family, they're all in the same wavelength, right?
Yeah.
So one of the reasons I started the practice is really to open that pathway and open that mindset that you know your education is one thing or your job is another. It does not make a career, right? And these days, it's so important to have your brand, understand how you position yourself because it's a snowball effect, right? And it's really important to know to get that support. And I see a lot of people, it's like, okay, CV writer or interviewing, practice. It's so siloed. If you don't even know what the hiring manager is looking for or what you even bring to the table, irrespective of a beautiful CV, which is what the AIs are, I think, doing. I know it looks beautiful. Yeah, you're not gonna get a call with that, right? And all these kind of fall into place, right? Even with the networking, I hear people, it's like, oh my gosh, I network, but I'm not hearing back. Well, how are you positioning yourself, right? Does it even make sense for the person to even connect with you? So it's a very holistic approach. I have, a LinkedIn lab, I have interview clinics, I have my live intensives that include workshopping, training, coaching. I mean, it's the full scope of what it takes to really position and pivot into a new career path in the industry. So,
Thank you. Thank you very much. It is really a multi-pronged approach. And this
yes.
is what I've been saying for the longest time. It's not one thing, it's multiple things, and they come together to form that perfect storm. Thank you so much. And this was a great conversation.
Well, thank you so much, Gertrude. This is awesome. I love talking to you. I think we have so much in common, and thank you for the opportunity to speak with you and to your audience about this. And I'm hoping that this helps a lot of people.
It will. It really will.